Okay, today we're going to talk about mastectomy surgery. So a mastectomy is removal of the entire breast. If you look at a breast, here, mastectomy is typically done through an elliptical incision around the nipple, oriented in a slightly horizontal fashion, and the skin around the nipple and including the nipple is removed. And from the side, what this looks like, so here's your breast from the side. Here's the nipple here. Behind the breast is the pectoralis muscle. So I'm going to write muscle. And behind the muscle are ribs. Those are ribs. Now the breast tissue comes up to the nipple, and there's a plane of tissue underneath the skin, which contains skin and a little bit of fatty tissue. And then the breast tissue starts, and this breast tissue runs down over the muscle, another thin flap of skin here, and up to the nipple. So everything inside of this circle here is breast. And when you do a mastectomy, you want to remove all of the breast tissue. And how we do that is, imagine that you're making your elliptical incision here. You cut the skin here, and you carry your plane of dissection, or your cutting, through this area here, and that divides the skin and the subcutaneous fat from the breast tissue. Then you come along the top of the pectoralis muscle underneath, and that divides the muscle from the breast tissue. And underneath the flap, you again divide the breast tissue from the overlying skin and subcutaneous fat and cut back up here to the breast. So when you close it, what it looks like is you still have your skin, and you have a thin flap of skin and subcutaneous fat. And on the inferior side, of the lower side, you again have your thin flap of skin and subcutaneous fat. Your muscle is still there. The ribs are still back here behind the muscle. Now this is the space where the breast was. This is the space here. What you don't want to do is have this fill up with fluid or blood or anything like that. So the skin is stitched back together here, put stitches in, and then we leave a drain tube inside of the breast space. And this comes out through a separate small hole and is attached to a bulb. And that's why there's always a drain left during a mastectomy type surgery, and that's to help close this space up. So if you look at it from the front, so we had a breast here, made your elliptical incision around the nipple, removed the nipple and the skin around the nipple. Then after you close it, still have your armpit here. There's a incision that's stitched shut like this, usually buried absorbable stitches. And then there's a small incision here in the drain tube attached to the bulb. Now with any mastectomy surgery for invasive breast cancer, and frequently for DCIS or pre-invasive cancers, because this is your one chance to actually check the lymph nodes, we frequently will do a sentinel lymph node biopsy by injecting blue dye and radioactive dye into the breast. This comes out to the armpit, marks a lymph node. And there's another talk about sentinel lymph node biopsy, but there's 15 or 20 lymph nodes or so in your armpit. We really only care about the sentinel lymph node that's marked with dye. Now this sentinel lymph node is removed, and a pathologist will frequently check this lymph node for cancer. If they find cancer inside of the lymph node, and they call us in the surgery and say, yes, there's cancer in the sentinel lymph node, frequently we will go ahead and remove all of the axillary lymph nodes. So if you have a simple mastectomy, that means you just remove the breast. If you have a simple mastectomy plus a sentinel lymph node, that means that the sentinel lymph node did not have tumor in it and you went ahead and stopped. there before you, without having to remove additional lymph nodes. Now, if you do a mastectomy plus a sentinel lymph node, and then it has cancer, and you do a full lymph node removal, this is given just a general term of modified radical mastectomy. So those are typically how we name the surgeries for mastectomy. Hope that helps.